Healthcare Management Forum Article of the Year award is focused on honoring a journal author whose article has helped to challenge the traditional notions of health leadership and motivate transformational behavior. The Article of the Year award highlights an original article published in the preceding year, which has helped to inspire meaningful reform and contains findings which apply to multiple sectors within healthcare. Thank you to Sage Publishing for sponsoring this award.
On behalf of Sage Publishing, I am honored to present the 2021 Healthcare Management Forum Article of the Year Award. This year's winning author is Dr. Stephen L. Archer for his article entitled Providing Care for the 99.9% During the COVID-19 Pandemic, How Ethics, Equity, Epidemiology, and Cost per Quality Adjusted Life Year Inform Healthcare Policy. The most downloaded ethics column of 2020, Dr. Archer's piece was chosen because it tackles the timely system-level issue of developing balanced healthcare policies that are nationally aware but locally informed. Dr. Archer is the head of the Department of Medicine at Queen's University and the Program Medical Director for Kingston Health Sciences Center. Congratulations.
Thanks very much, Lauren.
So what are your article's main takeaways for health leaders?
Well, the main takeaways are that this is a very complicated pandemic we're in, but we can't stop providing care for people with the many other diseases other than COVID-19. And while that seems very obvious, I think there's a tendency for people that want to be compliant with public health measures to err on the side of shutting everything down. But meanwhile, people are having heart attacks, strokes, getting cancer. And if we weren't careful, and I think we've been reasonably careful, but if we weren't careful and balanced, we could end the year with having not so many people die of COVID, but many more people die of all those diseases that normally kill people. And so it challenges us to be compliant with public health, but at the same time acknowledge that we've got to still be opening arteries that are blocked in hearts and seeing patients in clinic, and everything cannot be done by video. Otherwise, we're sort of penny wise and pound foolish.
Well, thank you so much for sharing with us. Congratulations again, Dr. Archer. Do you have any closing remarks to share?
Well, I'd like to thank the journal for giving me this honor, and also thank Renata Ilsa, who's one of our VPs. And Renata approached me one day and said, could you write something about your opinions? Because I write a blog for my department every day or twice a week now on COVID to make sure there's a rational feed so we communicate clearly with each other during the pandemic. And she said, would you mind writing this article? And so I set about doing it, and it was educational for me, and I'm very grateful for this honor. Thanks so much.